When I book a patient for a sutured IOL or a flange fixated IOL, I always look at the patient's medications, specifically to see whether they're on prostaglandins. And often patients that have a dislocated lens may also have coexisting glaucoma, and they may be on prostaglandins. So the prime example is pseudoexfoliation. Pseudoexfoliation causes glaucoma and also causes dislocated lenses. Now, we do know that prostaglandins may be linked with an increased risk of CME. And of course, it is a well-known fact that all sutured lenses, whether scleral fixated or iris fixated IOLs, may have an increased risk of CME. Now, if my patient that I'm scheduling for a sutured IOL or a flanged IOL is on a prostaglandin, I always have a discussion with the patient about considering switching to another agent. Because what I'm trying to do is reduce the risk of CME. And if I keep the prostaglandin, then the patient now has two potential risk factors that could potentially work synergistically in increasing the risk of CME. And so my take-home point with you is that if your patient is on a prostaglandin, let's say he or she is only on one agent, so just prostaglandin monotherapy, you could potentially talk to the patient about switching to another class that may not be linked with CME, because again, with these procedures, we ultimately want the patient to have a good outcome, and good outcome is not just a well-positioned IOL that's sutured or flange fixated, but also we want to think not just short-term, we also want to think long-term, and this is basically the tip that I wanted to share with you today. I hope you found this to be useful.